Hello everybody. I'm going to introduce a little bit about the manual therapy elective and particularly the use of ACE for it so you know exactly where to find the resources that you need. Firstly, obviously log on, and if I can remember my password, here we go. So what you want to look for, and you should all have access to 2014 688, which is the manual, which is the elective site. This is particularly why I want to show you a little bit around here. This is a site that is shared by all three electives, so the neurological elective, the pediatric elective, and our manual therapy elective. So it's a little different as to where you're going to find content. So firstly, you're going to get to this page, and where we're going to keep all the content for the manual therapy elective is actually here under resources. So try to simplify all the items on the left hand side just down to what we need, and what we've got here is the manual therapy elective. So you want to go into this folder, and what you'll find, we'll open up here, we've got the syllabus, and you can actually get in here. So what you'll see is that Sam and I are co-instructors in the class, but we will have a number of visiting instructors throughout this part of the semester. Typical class will be on a Friday morning from 8 until noon in room 250. In order to be eligible to complete this class, you have had to have completed all the previous orthopedic classes. You do need to have Job's Body. I have reserved 20 copies of this over in the bookstore. Some of you may already have Job's Body from 629 back in first year. Otherwise, you can either go to the bookstore on campus, or if you can obtain it elsewhere, such as Amazon, that's just fine. And most of you all will have the manual therapy compendium. You can read through here the objectives, course objectives, behavior, student responsibilities. This is a lab-based class, so you do want to attend and prepared to be available for lab activities, so just keep that in mind. Importance about turning in your grades on time, your assignments on time. Again, just a little bit of information about what is expected from your assignments, the quality of what you're turning in. Some of the instructions here as regards to instructor responsibilities, and then course assignments. So you need to have your take-home test ready by Friday, November the 21st, and I'll cover that in a moment, and then your professional development plan by December the 5th. And they're the two items that you're going to actually turn in. And you can see there how you submit both. Let me scoot down here into the actual schedule of the class. This is the tentative schedule, and we're going to be covering some more to do with trust manipulation. Chris Gregor Maxwell will cover more about joint mobility testing. Some of you may have been exposed to the Hesh method, and that's the essence of what she's going to present. Sam is going to elaborate on Mulligan concepts that you've learned so far. Mike Pulowski and Bob are going to come in and talk a little bit about Graston and ASTM respectively, so you'll get to hear both sides. Some of you may have been exposed to one or the other in the clinic. Now you'll get a chance to compare and hear about both. Denise is going to come for a slightly shorter session where she's going to talk about and give you a chance to experience some of additional Feldenkrais concepts. I know Sam has provided some of the patterns to date so far in the program for you, and then we will have a break over Thanksgiving, and then the last class, kind of the wrap-up class, I'm going to be covering some more elements about mechanical diagnosis and therapy. So far we've learned a lot about the MDT approach in the lumbar spine. We haven't really talked about it in C-spine that much, or the thoracic spine, and this year we're also going to cover about the use of MDT in the peripheral joints. So this will be a good chance to kind of wrap up and summarize on that. Also on the 6th, we will cover some other elements such as your professional development plans. So just to let you know that that is planned for there. So get back out here. So that's the syllabus. If we go back into resources, manual therapy elective, you do have a take-home assignment, and what we've been asked in the past is this would be really helpful when I'm on my final clinical time out to be able to start on this and not to have to try and complete it when I'm back on campus, because there's a lot of other things going on. So if you click on here, you will pull up a Word document. You can go in here and you can write down your answers here, A for true, B for false, and then when we see each other again in a couple of weeks on campus, I'll provide you with a Scantron and you can fill that in on the Scantron and then hand that in by the due date. So again, it just takes you through pretty much through the whole of Job's body, and just asking you to locate and find some of these key pieces of information. Let me just see. As much as it will be available to me, I'll provide the lectures to you. So if it is a guest lecture, I may or may not have access to the PDF to post, but as much as possible I'll try and do this. And then any additional resources, such as additional reading materials or support documents, I'll post in here. Last thing to point out to you here is in the discussion forum, part of your assignments and part of your grading for this class will be contributing your input on the topics we're going to cover. So if you go to discussion forums, class discussions, what you'll see here are the elements that we're going to be covering through the actual elective. And what you're going to ask you to do is just to post maybe on two of them your experiences, maybe in the clinic using Feldenkrais or Mulligan technique, and or if you had a patient and now that you've been exposed to something new through the elective, how you might have done something differently with your patient. So just want you to try and start having a little bit of a dialogue about these concepts so that you can reflect on what we've learned in class. So this is kind of just a quick tour. Get us back to the home page. Again, probably the most important place for you to go to are resources. Unfortunately, with the gradebook being a shared gradebook, we're not going to use the gradebook, but I will be able to provide you with up-to-date information about where your grade stands, particularly in relation to your assignments. If for any reason you need to contact myself or Sam or I, you certainly can use messages, though I would encourage more to use the UIndy email account. We tend to access that more frequently. And then the discussion forums. So look forward to seeing you guys all in a few weeks' time when we're back on campus.